What if your lower back is not stable? I suffer with chronic migraines. I also have degenerative disc disease. And after the class, my head opened and the migraine subsided. So this what they were asking during the migraine section, migraine section, when you were talking about it. And they're asking, what if your lower back is not stable? I suffer with chronic migraines. I also have degenerative disc disease. And then after,
in the low back or in the neck?
Is the degenerative disc disease in the low back or in the neck? In the low back.
Okay. So the neck work made the migraines better, but they're asking about low back.
Could you say yes or no to that? Yes.
Yeah. Well, I mean, I would do things to kind of clean up the low back in a couple of different ways. One, I would use like the pain relief neuropathic, or is the I guess is the pain like really close to the vertebrae or in the vertebrae, or is it just like kind of in and around that area? Yes, that's a better question to ask.
Both.
Okay. And does it go side to side across your back or up and down?
Side to side.
Okay, so this is what I would do. I would treat the spinal area with the pain relief neuropathic. I would treat it also with like applying like some marjoram there, rotate them and just try to open that up. But when you see the side to side stuff, it's actually also referred pain coming from abdominal muscles. And so the area below your rib cage all the way down to below your navel, like your, what would you call that, like the waistline, I guess, like where your the waistline of like where your underwear would hit or something, that line across there. I would treat the yeah, that's what I was trying to figure out, like, because women wear it up kind of high. So like down to like the top of the hip bones, like just that whole area. I would put something like marjoram on that area, like marjoram, basil, terebinth, black pepper, pepper supreme, something that's antispasmodic, and will help clean that up. But you just like, in an ointment or a liniment, or if you're especially like using terebinth, just like drop it on the abdomen and then just really kind of rub it around. You could also do that with marjoram. And the more that you treat the abdomen and you decrease the trigger points in the abdomen, a lot of times the back feels a lot better, because the pain is actually not the back muscles, it's the stomach muscles, and it's referring pain back to the back. The pain that's in the spine is in and around the spine. That's what you're putting the pain relief neuropathic or the peppermint on, to unwind that. So the combination should be very helpful.
They're saying thank you, but I also have a pinched nerve in my neck. Would there be
Do the same thing but up on the neck. Like I would put the pain relief neuropathic up there, but I was kind of weighing out, like when we were talking about this, one of the things that I like to use, especially in chronic pain, is there's that blend nerve help, and it's a pain reliever, but it also has like a lot of a lot of things are antispasmodic, and then it has sage, and it kind of helps to undo some of the neurological like patterns that can happen in the body. And so it might even be a thing you want to put on your abdomen, and you could put it on your neck. It's very soothing. It's kind of my go-to thing. And you could rub it on the neck. And then from the neck class from the weekend, using the lantana and anise, going back and forth to unwind the sternocleidomastoid. And if you can add a little vetiver to the base of your skull, along the back there, that should really help unwind the pinched nerve in the neck.
I do have the spine oil.
Yeah, that does something a little bit different. Here we're trying to go after like an issue in the spine, and so I mean you can inhale it, but like I'd still stick with the things that we're talking about to unwind the potential problem.
Thank you so much.